Hi, my name is Yvonne. Today I will be talking about Rabeprazole. I will be discussing what this medication is used for, how to take it, what the medication's common side effect, when to reach out to your doctor, and provide some background information about this medication. Now let's talk about what this medication is used for. This medication can be used to treat and provide symptomatic relief of erosive or ulcerative GERD. Rabeprazole can also be used to treat daytime or nighttime heartburn and other symptomatic issues related to GERD in adults for up to 4 weeks. It can also provide short-term healing in symptomatic relief of duodenal ulcers for up to 4 weeks. This medication is also commonly used in the H. pylori eradication regimen. It is a 7-day regimen of a combination therapy of rabeprazole, amoxicillin, and clarithromycin. Rabeprazole can also be used to treat hypersecretory conditions such as Lenzinger-Ellison syndrome. Now let's discuss how to take this medication. The patient are generally advised to take this medication with a full glass of water. Swallow the tablet as a whole. Do not chew, crush, or split the tablets. For GERD treatment, take 30 minutes prior to a meal. To treat duodenal ulcers, take the tablet after a meal. For H. pylori eradication regimen, take the tablets with food. If the patient happens to miss a dose, take the medication as soon as possible. If it is almost time for the next dose, skip the missed dose and go back to the normal schedule. Do not take 2 doses at the same time. The most common side effect of this medication includes headache, diarrhea, nausea, vomiting, abdominal pain, general pain, pharyngitis, and flatulence. When should the patient be advised to contact the doctor? If the patient is experiencing diarrhea that is watery or has blood in it, or when the patient has joint pain or skin rashes on the cheek or arms, and that is worsened in the sunlight, the patient should contact their doctor immediately. Now let's talk about the background information about this medication. The classification of this medication is proton pump inhibitor, PPI. It inhibits gastric parietal cells hydrogen potassium ATPase to reduce the stomach acid production, in turn relieve the symptoms of the patient. Let's discuss the dosage to treat GERD. The dosage for GERD is the same, but the duration of treatment varies per condition. For acute erosive or ulcerative GERD, the duration of treatment is up to 8 weeks. Maintenance of the healing of the GERD, patient can be on this medication for up to 12 months. For adult patient that is experiencing symptomatic GERD, treatment is up to 4 weeks. For adolescent 12 years or older, their symptomatic GERD can be treated with this medication for up to 8 weeks. The dosage to treat duodenal ulcers, H. pylori eradications, and hypersecretory conditions are as followed. For duodenal ulcers, the patient is advised to take 20 mg once daily after morning meals up to 4 weeks. For H. pylori eradications, the patient should be taking this medication 20 mg with amoxicillin 1000 mg, clarithromycin 500 mg together twice daily with morning and evening meals. It is important that the patient take this medication for a full 7-day regimen. For hypersecretory condition, the patient's starting dose is 60 mg once daily, then adjust to the patient's need. Some patients might require divided dose. Let's talk about some of the most important adverse events when taking this medication. This medication can interact with warfarin when taking them together. It will result in increased INR and PT, in turn increase the risk for bleeding. This medication can also increase the risk of C. diff infection after a prolonged period of use, especially in hospitalized patients. Bone fracture is another adverse event that can occur when taking this medication for a prolonged period of time. The most common site for fractures when taking these medications are hip, wrist, and spine. The patient may also experience decreased renal function after prolonged use of this medication due to acute tubulointerstitial nephritis. When taking this medication for longer than 3 years, the patient may develop malabsorption of vitamin B12. Patients should be advised to consume diets that's high in vitamin B12 when taking this medication. Food that's high in vitamin B12 are tofu, cheese, fish, milk, egg, meat, and shrimp. Patients' magnesium level should be monitored regularly because magnesium deficiency can develop in patients who are taking this medication for longer than 3 months, especially those who are on digoxin or diuretic. The most common signs and symptoms of magnesium deficiency are constipation, muscle spasm, anxiety, headache, and difficult sleeping. And this concludes today's presentation. Thank you.